Hello everyone. Autism spectrum disorder. When we get this diagnosis, obviously we know that there are going to be lots and lots of therapies. What comes to our mind is that when a parent goes to a professional and the diagnosis of autism spectrum disorder for the child is confirmed, the obvious step is that probably in the coming week or in coming few days, the therapies will start and the child will start coming for the sessions. Well, it's not that obvious as I'm saying it. Because what happens is when a parent gets the diagnosis confirmed from the professional, although the professional might give the entire schedule of what therapies are to be done and how it is to be done, that is not that quickly that all this gets started for the child. The first reaction of the parent when he knows that the child has autism is of a shock, and that shock leads to denial in the parents. Denial where the parents are not able to accept the diagnosis. They don't believe that yes, there is definitely something wrong with my child, and that puts them in the cycle of getting more and more opinions from people trying to confirm the diagnosis. Honestly speaking, when a parent approaches for second opinion to somebody else in bid to confirm the diagnosis, actually the parent is not trying to confirm diagnosis, but trying to reach out to different people to hear that the child has nothing major or the child doesn't have autism. And that is something coming from a very subconscious parental instinct and what the parent want to just hear that there is nothing wrong with the child. Okay, the problem with this is, remember, the problem is not going for the second opinion. Problem is not about going for the second opinion. Problem lies where a parent is going to from one professional to other just to listen that child has nothing. What happens there is that we lose a lot of important time in the child's life. And with that important time, I mean that the child has the maximum potential, or rather the child's brain has maximum potential to remold till he reaches at 5 years of age. Now suppose a child gets a diagnosis from one professional that he has autism at the age of 3, and the parent in bid to just trying to confirm or just trying to see that somebody tells that the child doesn't have autism keeps on going from one professional to other for say 6 months. What has happened here is that we have lost 6 crucial months of the child's life where a major change can be done in those 6 months by starting the therapies. Why I'm saying that this is a major period that we are losing, because remember, neuroplasticity or the ability of the brain to change is at its peak till the age of 5 years of child, or till the age of 4 to 5 years of the child's life. That is why any intervention started as early as possible in that period will lead to a very significant change, and this change will be much more quicker. Once the child's age crosses beyond 5, the ability of the brain to rewire and remold slightly falls down. And that's why then the change that we want to bring about in the child will become a little prolonged and will be a little more difficult. That's why the treatment and the intervention being started as early as possible after diagnosis is very important. This is first part of the treatment. Second part, first part where I want all the parents to know that go for a second opinion, but don't keep on going on and on about it. Okay, you have one more opinion and then start right away with the therapies if the diagnosis is reconfirmed. This is the first part. The second part of the treatment is, please remember that once you start the therapies, be clear about your goals. I have had a case of a parent whose child was diagnosed with spectrum when the child was 3 years old. At that point, one problem the child had was that the child was not able to speak a single word, not even mama or baba. Okay. The parent started the speech language therapy from the speech therapist. And in 3 months, the parent came to me disturbed saying that, ma'am, I have been doing speech therapy of my child, but there is no improvement seen. My child is still not talking. When I inquired in details, I came to know that the child is now using 2 words and forming sentences in 3 months of speech therapy, where he says, Mama come, Baba go, which was absolutely absent 3 months ago. Now, there is a definite progress, but the parent had already given up and stopped the speech therapy because the child was not talking like other children. So there was a problem in the goal that the parent had in the mind. So it is very important that we as parents, when we are starting therapies, we focus on the smallest progress of the child when the therapy starts, rather than comparing with it with other children, or rather than having way too big goals. Okay, for this you will have to discuss with your professional and identify what are the goals that we are looking at every step, after 3 months, after 6 months of starting any kind of therapy. And remember, we are looking for progress in our children. Those are diagnosed with autism. We're not looking for perfection. It's not about perfection. It's about the small steps that the child takes and overcomes its deficits in a gradual manner. And as it comes logically that we're trying to rewire and remold our brain, and that complete rewiring or remolding cannot be few weeks or few months job. It is going to be a little continuous, it is going to be prolonged, and it will keep on changing. The goals keep on changing. So today, if the child is speaking 2 words, tomorrow after 6 months we will have a goal where child will be able to form 2 sentences and communicate, right? So the goals keep changing, and we have to keep giving therapies till we achieve each set of goals. And that's why the therapies in autism, or the treatment in autism, is way longer. Okay, but that is what is going to be rewarding at the end, if we continue that patience and we continue to be rational and logical. That is the second part. The third most important part is about the therapies per se. If I want to divide the therapies that are available on autism, I will divide them in two broad types. The ones which have been proven scientifically to be effective via thousands of researches, and the others which have been effective but only in some cases. There are only some anecdotes where a particular treatment or a therapy has been shown to be helping the child. Okay, so our as a parent, what we need to do is see to it that we first start the therapies which our professional says, which are usually the ones which have proven their efficacy via proper researches. These therapies include some of the important ones, such as uh, occupational therapy, some aspects of physiotherapy, sensory integration therapy, ABA, which is called as applied behavioral analysis, some aspects of cognitive behavior therapy. Then you have social skills training, of course, the language or the speech therapy, what you call it as. These are the therapies which have proven their mettle and have shown significant change in autistic children. So these are the therapies that we have to resort to first. Does that mean that we should not try many things that come across on the internet, or whatever is told to us by some people, or somebody comes and says कि मेरा बच्चा ये करने के बाद एकदम अच्छे से socially communicate करने लगा? Does that mean we don't pay any attention to that? No. We can consider that, but remember to talk to your professional again and see that if that also can be incorporated. It is essential because there are no manuals when it comes to treatment of autism. We have general guidelines, and sometimes some things do really help children. Then why not try? But the trying has to be again rational and logical, and not out of desperation. I have had parents who have started occupational therapy, speech therapy, social skills training, homeopathy, acupuncture, and some naturopathy and diet all together on the child. What happens is that the child becomes overloaded, we as parents become overloaded, and at the end, many times when we start too much, we expect also too much. And when we don't get that, we feel cheated, we feel defeated, we feel itna kuch kiya lekin kuch farak nahi pada. That's the state that we land up, which is again counterproductive. And that's why we have to be very sensible if we want to try some alternate therapies as well, which haven't been proven very well, but yet we think that it may help. Again, when you try that, remember that try it only for a while. So maybe you can discuss with a professional and say, okay, I will try this particular diet for say 3 months. If there is no change, let us move on. Let's not continue with that. Okay, so remember these few basic understandings about what all therapies we should start apart from the ones that your professional has already started for the child, right? Don't get carried away by internet, don't get carried away by the Google. Be very logical in choosing whatever you're choosing for your child. Remember, your child is not an experiment, right? And one more thing that I want to just suggest to all the professionals, if you're watching, is that when a parent comes with something from Google, saying, Doctor, ye dekho, ye bhi hai, kuch ye kar sakte hai kya? Do not judge the parent. You can judge the therapy, but don't judge the parent. Parental instincts and parental love will make every parent to Google things, to search out things, to find out something unheard of, wanting it to try with a child, and that's why he's coming to you. Okay, so if you're judging the parent, you're judging the parental love. So please don't do that. Judge the therapy, find out what the parent is trying to tell you, see to it what it is all about, do your own research on that, discuss it with parent, and then with a collaborative understanding, the decision about these alternate therapies can be taken off. Okay, eventually all we want that our child should get better in any ways, right? So whatever works works. Let's be open, let's be flexible, but at the same time let's not act out of desperation and get carried away.